focusing on you. Innovations in modern medicine from your team of experts at UHealth, the University of Miami Health System.
As chief financial officer of Jersey Mike's, Walter Toombs wasn't ready when a heart condition halted his life.
I had to go to the hospital, and they actually have to shock me back into rhythm.
Walter had mitral valve disease, where the valve doesn't function properly, causing blood to leak back into the heart. He traveled to UHealth to see world-renowned cardiac surgeon Dr. Joseph Lamelas.
Mitral valve disease is actually quite common, but should not be taken lightly because it will, when it does progress to the point that it's significant, it will begin to affect the heart muscle.
Walter knows this firsthand after losing his mother to the same heart problem.
My mom had passed away at a young age. In fact, she had passed away at my age right now. So at 56, 57, she was already deceased, and that was tough on our family.
Walter needed surgery to repair the valve. Instead of traditional open heart surgery, Dr. Lamelas pioneered a minimally invasive approach called the Miami method.
I make a 5 centimeter or 2-inch incision between the ribs on the right side without breaking the ribs or interrupting the blood supply to the chest wall. And then I utilize special instruments, some that I've developed, in order to go in and fix the valve.
Doctor, tell us about the award UHealth recently received because of this procedure.
We recently received the Mitral Valve Repair Reference Center Award, which is given by the Mitral Foundation and the American Heart Association. And the institution needs to perform more than 80 mitral valve repairs a year with greater than a 97% success rate. What a reference center is an institution where patients should look to have their mitral valve repair, because these are the centers that have the most experience.
After his surgery, Walter is back to work, playing golf and looking forward to the holidays.
I feel great. It's really changed my life.